Hey everybody, Brett Rice, coreVISION Financial Group, coming to you today with another video in our series on financial topics. Today we're going to be talking about Medicare, and we have a couple guests in studio today. We have Nolley and Ashley Livezy. But go to our YouTube page, subscribe to our videos so you're notified when we post a new one. So guys, give us a quick introduction, talk about Compass Insurance and what you guys have going on.
Well, for me, personally, I just finished my 40th, or just came up on my 40th anniversary in the insurance business. Started with another company was there about 21 years in various roles, from agent all the way up through some home office positions, and then decided to break out from that and work with baby boomers as they were starting to hit and get onto the Medicare market, and end up forming Compass Insurance Group, and officially formed that in 2010 and been doing that ever since. Was doing a little bit before that, but under more of just an independent kind of situation. So our primary focus at Compass is the senior market with Medicare and people, say 55 up, 80. We work with anybody, but that's kind of our primary focus is in that area right there.
And I'm Ashley Livezy, Gary's daughter. Been at Compass for 4 years now, I think it is. Yeah, somewhere around there. Doing the same stuff, just learning everything that I can from this guy who's been doing it way longer. And then we had my sister join, his middle daughter, back in June of this year, Heather Wilson, and she is doing great. And
fantastic.
Now the three of us are in there on the daily, helping everybody.
40 years. I mean, that's a lot of experience. You've probably seen a ton of change to Medicare, haven't you?
Yeah. To everything. I mean, even doing life insurance, I used to have to quote out of a book, look up
for
stuff
sure.
and hand calculate and do all kinds of stuff. And
thank God we don't have to do that anymore.
Yeah. So, big changes from how Medicare worked to the technology. These things didn't exist, this event, like a podcast. And so much change.
Yeah.
Inside and outside of it.
Like, I've only been in the business 10 years, and it's like, you don't think about that. Like, what did we do before computers? How did we do that? You start talking about manually calculating life insurance premiums and stuff. That, and like you said, that makes my head hurt, right? Just going, oh my God.
Makes my palms sweat just thinking about having to do that.
Paper applications. You have to fill out a paper application and then mail it in, or if you were high tech at some point, maybe it wasn't the 80s or 90s, you had a fax machine that would take about a minute a page or whatever. So, a lot of changes have taken place, and much more rapid responses, and AI being used in some cases and stuff. So, a lot of changes.
Yeah, the fax machine is still relevant
It's
in the
funny.
government world.
Yeah. I mean, when I started, there was basically a product, a Medicare supplement, and it wasn't even regulated to the point where they were standardized, which we haven't got into that yet, but they were just, any company could make up anything. It was crazy. It was hard to compare them. It was very confusing. Clients had to file their own claims with the insurance company after Medicare process, and all that's now integrated. So, a lot of changes, a lot of use of technology, and a lot of improvements.
Sounds like the Wild Wild West.
Yeah, it was. Yeah, it was much, much different back at the time. Yeah.
It would be incredibly difficult to compare products across companies if they're not the same. You're just like, and explaining that to somebody who's trying to learn about Medicare is, it was probably not a good place to.
It's already confusing enough.
Sure.
Having
it's
to
very
add that
confusing for people.
into it would be crazy.
That's what we see a lot. The one thing that hasn't changed is the anxiety of going on Medicare for a lot of people as they approach that, because they've always had the boss and the HR that said, here's the plan. And go, okay, I signed up, and they're done. If they had a question, they can ask them. Well, they lost all that when they turned. So they like, where do I go? How do I do this? I don't have anybody to hand it to me. Now I have to shop. I have to figure all this out. And I would say 70-80% of the people come in are very anxious and very overwhelmed by it. So our job is to,
and a lot of times misinformed, which adds to the anxiety.
A lot of that. Oh, so and so told me this. Oh, you talk to people.
Which is good, and also your worst downfall.
We find the same thing in investing. People come in, and they've been listening to the guy who sits next to them at work, or their brother-in-law or something, and they're just like, the misinformation is prevalent in everything. So that's a great place. You're starting the topic here. So what is Medicare? Let's just get into the basics of it. What do people need to know when they're, preparing to sign up for it?
Okay. Well, first of all, it's not Medicaid. Well, you have people come in and say, what, Medicaid, Medicare, what? Medicaid is a completely different state-operated program based on income. Medicare is a federally run program. There's parts A, B, C, and D, which we'll talk about. In general, you get onto Medicare or become eligible when you turn 65, though you can get on there younger if you are qualified for Social Security disability and you've gone through, been on that for at least 25 months. The 25th month, they automatically enroll you in that. So a lot of people don't know that you can get Medicare under age 65, but it is involved with a disability situation and specifically Social Security disability. But probably for what we're going to do, we're going to focus on talking about the majority of people, which would be those turning 65. So you got Medicare A, which is your hospital coverage. And for 99% of people, they don't pay for that as long as they worked at some point in time or were married to somebody who worked and had their 10 quarters in.
40 quarters, 10 years.
Or 40 quarters, 10 years, I'm sorry. And no cost for that. Part B is the medical part of it. For most people in 2026, that has a premium that they will pay of $202.90. That does change every year. If you're drawing Social Security, they take that out of there. If not, they'll send you a bill for it. So that's the foundation of that. That's the actual government part that's been around since 1965. And then beyond that, we get into the C and the D, which is Advantage and Prescription, which are, and Medicare supplements, which are what work along with those to, in different ways to provide ways to fill the gaps or reduce the out-of-pocket expense that Medicare itself would leave you with. So that's kind of the, have I left anything off on?
I would just say Medicare itself only covers 80% of your costs. So without either a supplement or an Advantage plan to round that out, you're on the hook. Now it's not like an astronomical amount.
No, but a long-term.
Yeah, long-term it could really.
Yeah, it could get very expensive without those. So you could mitigate those expenses by coming in to see somebody like us and finding out whether a Medicare supplement with a prescription plan, Part D, or a Medicare Advantage plan, which is Part C, is a better way to go. And we help guide you through that process of explaining what the two are and the pros and cons of each and let you kind of just settle into what works for you.
In some of those situations, does the income of the person affect which plans they should take, which ones they shouldn't? Or
well, we could talk about the greedy old lady Irma first if you want, because for some people who, especially if they're retiring and taking some distributions, Irma, I can never remember the
income-related modified adjusted amount.
There you go. So
this is why he asked me to join us.
Yeah, I can say Irma. I just call her a greedy old lady because what that is, and that doesn't really necessarily affect which plan you take, but for somebody who happens to be a high earner, or even if they're say not a high earner but take some distribution, your income can affect the cost of your Part B. So most people will pay $202. But if you happen to be making for a single person, was it around $110,000 this year, a little bit over there?
Yeah.
A married couple's $225,000, $230,000. I forget the exact numbers. Google it and find that. You get the privilege of paying extra on that, which is a shock to some people. Had a lady the other day calling because she's paying almost $600 for her Medicare because she got married and now it's a joint income and the spouse makes a lot of money. So it can be a real shock to people about that. And that's kind of a deeper topic to go into, but if you are going to have some higher income, that's something you want to be aware of, and we can help guide people. That could be a whole topic unto itself on how IRMA works. But so that's kind of what happens when you get signed up for it. Beyond that, as far as which way a person goes, I would say we just explain both. And if a person has very modest income, they're probably not going to be able to afford the supplement just from a premium standpoint. It's very, very good coverage. You have very low out-of-pocket expenses once you have it. But for somebody who's making $1,500, $1,800 a month, and you're going to pay $150, $160, 10% of your income.
Right.
Plus the prescriptions, you might have some copays. So it depends where you're at with some things on there. The Advantage plan, it gets some bad knocks sometimes, but just like anything, there's seeds of truth and all that, but it's not always, it's the majority of people end up going with it. Probably 80% of our clients.
I would say the younger the people are aging into Medicare, the more they like an Advantage plan, mostly because we're all used to a group plan or a marketplace plan where we're paying an arm and a leg each month with a high deductible, and then we never go to the doctor.
Yeah.
Right?
Yeah.
An Advantage plan, Most of them have no monthly premium to them, and you have a copay only if you have something done. You have a test done. But if you see like your family doctor, there's no copay. If you have your labs done, there's no copay. Your preventatives, no copay. Right. And that's what the people are doing, right? So they're looking at that and they're like, well, this worst case scenario maximum out-of-pocket amount is half of what my
old deductible was.
Yeah, my old deductible was, right. And I don't go to the doctor anyway, so why would I not do this? And I'm like, well, that's for you to decide.
Right.
But I mean, that's what people are looking at now that they're aging into Medicare. They're like, this is better than what I had in my group plan in 95% of the cases.
Yeah. So we try to do it in a consultative way, explaining how they are, and usually at the end people go, well, why wouldn't I just do that?
Yeah.
They come to their own conclusion with that. I'm not going to try to push them one way or the other. I'll explain why some people don't agree with that and go a different way, but that's that personal choice. So. And
there are times where we say, the Advantage plan probably isn't for you at this time. You probably should start over here for X, Y, and Z reason. Yeah. But unfortunately for most people, those supplements will eventually price themselves out of affordability, and 99% of people are going to end up in an Advantage plan at some point anyway.
Just they'll not be able to afford the supplement as they get. And that's going to get, for reasons that we don't have time to get into on here, those prices we're going to see them go up quite a bit. Yeah. Utilization and a lot of different things are happening. They're driving those costs up. And it's also affecting the Advantage plan. Some of those benefits you're going to see cut back a little bit going forward. But again, those changes are kind of what make us important, because people always feel a little bit intimidated and overwhelmed, and when they get the changes for the year, they're like, I don't know what's going on here. So our job is to say, okay, come in and let's talk about what these changes are. We're trying to defend the companies when they cut stuff back. We're just trying to explain what's going on. It's the economics of things. So it's been a disruptive year or two in the Medicare world and what's going on with plans, prescriptions, some good and bad and all that. And our job is to help get all that crud out of the way that's helping
navigate
them get it against,
Navigate it.
Yeah, trying to navigate the insurance maze.
Insurance maze, yeah.
That's our old tagline.
Yeah, for people that don't work in this every day, it can be very overwhelming to just start doing the research.
Yeah.
And then you start, which one do I have to have? Which one am I like, having someone like yourself walk them through where you can kind of start putting dollars in there, and you can say, okay, here's, if last year would happen again, this is about what I would have paid.
Exactly.
On this plan. This is what I would have paid on this plan. But people need some guidance on that for sure.
They do. We can usually knock it out in 30 to 45 minutes too, because we've done it so much.
Right.
If you're doing the ones who come in probably the most confused are those who did most of the research on their own. I've checked all this out and this is what I want to do. I said, okay. But I'm going to do my job first, and I'm going to explain both sides. And in the end, we may be on the same page. When I get done, I go, I didn't realize that.
Yeah, for sure.
Because they didn't know to research the details of their prescriptions or the network. They were just looking at different things. And you're trying to look at every single company and every single plan. And most companies have 3 or 4 plans.
Well, and a lot of times, even from there, a lot of people aren't narrowing it down to, all the commercials say, check your zip code, check your zip code. People aren't narrowing it down to their zip code to what's available. So they're looking at these big, opinion pieces too that are nationwide, but they're coming out of Texas or California or New York, where I'm sure things work very differently there. They're bigger states. They have more going on. But in the state of Indiana, it's not quite as, I don't want to say as confusing, but it's a little more straightforward, I would say.
Yeah. And we focus, that's the other thing too, we focus on central Indiana. I mean, we've got clients other places, few out of state, northern, southern. We know the market in the middle, so we know which plans, without having to look it all up, we know which ones have what hospitals and network. So if you come in and say, I have to have St. Francis, okay, these 3 are off the table. So why waste your time? I know that. You don't know that, so you're going to spend all your time looking it up.
Yeah, I didn't know that.
Yeah.
You just told me something. I was like, I didn't know that.
Yeah. So I have a big company that I think I'm not sure St. Francis is in their network. Now I'll talk with you about that offline. That makes a big difference for us who live here in Shelbyville. And I know your audience is different places, and this can vary. But for us here, we have major hospital, and a lot of their heart doctors, and it seems like I have a lot of clients that have heart doctors, they come out of St. Francis. Yeah. So even though they come here, they're St. Francis. So if St. Francis is in the network, you don't need that plan.
Right.
It's going to be a problem. So those are the details that we know that you're going to have a tougher time knowing that. So I don't have to show you 14 plans. I already know from a few questions, we're going to narrow it down to these 2 or 3.
Yeah.
To these 2 or 3 companies,
Yeah.
and this 1 or 2 plan from each of it. And usually, they don't even, as I'm talking, I'm eliminating stuff as I go.
Yeah.
And then I get down to, and I still will show them the Medicare supplement. I will show them what is probably the right Medicare Advantage plan after we've checked their prescriptions to see, because not all plans cover every prescription, and they put them in different tiers. So there's a lot that goes on. And I've got a computer that does all that for me now, okay, in a program.
Right.
If you're
Right.
sitting at home, you're looking, I don't know, you're on Medicare.gov maybe for some people who are tech savvy enough to do that and putting that in, but that's still not enough. So it's the nuances, the little things that we learn along the way.
I like to tell people that we have, you know, like you said, 15 options just in our county. I'm narrowing it down from the Cheesecake Factory menu to the special of the day. We're talking about what works for them based on what we've talked about.
Yeah.
Yeah, because a lot of times people do the research on their own, not knowing this thing. Like you said, you're looking at an opinion piece from Texas when, no, you need to be
Yeah, in
zip
Indiana.
code,
Yeah.
this hospital, this doctor, this medic, it would really narrow it down. I mean, I didn't know that about the zip code and the hospital network. Yeah, that's got to narrow it down significantly, I would think.
Yeah, we even go, hey, my cousin's got this plan. It's really good. And he says, oh, well, he lives down in Brookville. Oh, you can't get that plan in this zip code.
Yeah.
We have a very, very similar one, but it's going to be different. Might be better, might be worse in terms of what you're looking at.
Right.
Not better or worse, but it's going to be different.
Yeah.
So, yeah, it can be very specific to your county.
Or even now this year, Rush and Decatur County lost quite a few options.
Yeah, Anthem and Aetna pulled out of those, so those people had to go find things. So that's part of that disruption that really took place this year, which is very unfortunate. I mean, for us, from a business standpoint, it's good because people need us in that situation. It made us very, very busy. And fortunately, we had options and knew how to navigate that. It was tough for us, though. I mean, we were like,
trying to
that company left that plan.
Yeah.
It was tough to keep up with all of it. It really was.
And really, there's one zip code where if you're on one side of it, you're in Shelby County. The other side is Rush. The other side, you're Decatur. And so if you're talking to your friends,
if you live in St. Paul, or if you live in Edinburgh,
or even
those
sometimes
counties
in Manila,
those cities are split.
Yeah.
So your neighbor across the street can get a plan that you can or can't get.
Yeah.
So, it's
Disruptive
it's tricky.
is the nicest word.
Yeah. All right. You have to go into every situation with every person. No assumptions. Hey, what is your situation? We have conversations with that with people come in. Your investment strategies could be completely different than your neighbors.
Oh,
because your
absolutely.
situation's completely different.
Yep.
Right.
So it's very similar to that. You can't take in any assumptions. This person lives here. They're automatically want to. You can't do that.
You have husband and wife sitting up on different plans.
Yeah.
They all think, well, if we're on the same plan, it's going to be easier to manage. No. Okay, this person has these issues. Maybe they are a better candidate for a Medicare supplement because we know they're walking in with just oodles of problems up front, and at least to start off with, that's going to be a better option. And the other spouse is like healthy as can be, and so when you're trying to, especially 2 people going on a Medicare supplement, that's a lot more premium for the household. So you don't have to be on the same plan, and that's, again, people don't realize that.
So you can customize it that way and try to.
Because they're individual plans tied to your own Medicare number. So
Okay.
Yeah,
so
not like a
there are no
group
family
plan
plans. There's no
Yeah.
there's no mom and dad plans or whatever. So it's everybody's individual plan.
And you get a Medicare number.
You do. So when you sign up for Medicare, and we talked about that real quick about how you get on Medicare. We talked about
absolutely.
If you need to get on Medicare. Yeah.
So for those who are going to age into Medicare, let's clear up one misconception. Just because you're turning 65 does not mean you have to go on Medicare, okay? Maybe come back to that. But if you do, a lot of people will come in, they're thinking about retiring. One of their stops is you guys to see, do I have enough money to retire? And then what you might say, well, it depends on what you've got to pay for your health insurance. Here's the money. You got to figure out your bills, right? And we are one of those bills. So a lot of people coming to both of us in those times. So we'll go through and help them look through that. But if you want to start it, you can start about 3 months before, and you need to set up a socialsecurity.gov account or SSA.gov. which we help people do. A lot of people are not comfortable doing that. It's a little harder now because there's some security features they've introduced, which you're shaking your head, so you've dealt with that.
Yeah, that's one of the things we tell people very early on. I mean, we'll tell people in their 30s, get you an SSA.gov.
Yeah.
Right? Because we've sat down and helped people try to answer those security questions, and sometimes it's pretty tough when somebody's in their 60s, and they ask a question about something that was 30 years ago. They have no idea.
Yeah.
So then they end up having to go to the Social Security office.
Yeah.
And you're like, okay, that was a little more difficult than it needed to be, but it can be difficult.
Oh, yeah, because sometimes the technology of taking the picture of the license and then getting the picture.
Just setting the account up.
Once you get set up, it's easy, but they have made it more difficult for security reasons. So you have to come in with a picture ID. And
we kind of understand some of that, right? Because there's some very valuable information in that account that if it falls into the wrong hands, it could create a lot of problems for you.
Yeah.
But I would just like to think that there might be an easier way out there.
So if you can set it up on your own before you come in to talk, whether it's to you or to us, that's good. But if not, we'll help you. We during COVID, we started doing this because people couldn't get into the offices and they weren't comfortable on the computer. So they come in and we've become the de facto Social Security. I bet we do as many Social Security people as the office does in Columbus. I mean, we do a lot. And we don't charge for that. It's just a service because we know you're going to come back for a product that we have and refer people in. And it's just part of the service that we do,
For sure.
It takes a lot of time. And so far, we get that set up. And you don't have to do the Social Security at the same time. Some people don't want to start that. Remember, they want the Medicare. In that case, they'll get a bill for the Part B premium. But anyway, once we get the account set up, it only takes about 10 minutes to get you signed up for Medicare, which is Medicare and Social Security are all done on the same site, SSA.gov. They can be done at the same time or they can be done at different times. We have some people who are going to keep working and they have group insurance. If that's the case, you do not have to sign up for Medicare. You can do delayed Medicare without any penalties. So it's important to know we have a lot of people come thinking they have to do that, but they don't. And if you have group insurance through your employer, you can put it off until that group insurance ends or you want to back out of it. We also help people to decide do you want to stay on the group or not because maybe it's expensive and has high deductibles and you're better off on Medicare. So we'll help them figure out which way to go on that. So they can delay that and there's a process to start it back up when you are ready to go on Medicare and leave the group insurance. Some of them will start Part A only, which will cover the hospital, and it will work with their group insurance at no cost to them. And there's times you can't do that, and we can help them figure that out as well. So once you do that, within about 30 days, you get your card back. At that point in time, the reason we want you to start about 90 days out is by 60 days out, you have your card in place, and then we can have a second interview where we sit down and go through option 1, option 2, Medicare Supplement, Medicare Advantage, what works for you, and get into all that and look at their prescriptions, look at their network of doctors, and help them draw a conclusion on that.
And even just to tag on to that, the Medicare enrollment period is actually 7 months long. So you can start at 3 months before, but you also have the month that you turn 65 and then following 3 months after that.
True.
So people think they have to come in, and that their insurance or Medicare is not actually going to start until the day of their birthday that month. Well, it actually starts the first day of that month. Doesn't matter what day you were born. But you have 7 months to do that. And then, again, the caveat is unless you have group coverage that's, giving you good benefits, then you don't have to do that at all.
Yeah. And we'll make sure we time everything so there's no gap in coverage between work and this and all that stuff. So
you guys will help people evaluate that. If they have, if they're still working, have a group plan, you'll be like, hey, here's what, if you want to go to Medicare, it'd be this, stay on your plan as this, deductible.
Right.
Okay. Yeah, that's something I would assume most people over 65, not yet ready to retire, probably need to look into.
Yeah. And you have spouses that are different ages. Maybe, maybe the wife is the older one, but she's on your group insurance, and you think, hey, because a lot of times you pay more for a spouse.
Sure.
So you come in and I say, hey, she can age on to Medicare. Your employer's going to love you because she's very expensive to them and she's very expensive to you as well on premium. I want to clarify. If you're paying out of your payroll, let's say you get a weekly payroll and it's $100, $150 a month for the spouse and it's a $4,000 or $5,000 deductible, hey, your Medicare is going to cost you $202. If it's an Advantage plan, it won't cost you anything. You won't have as high of out-of-pocket expense. It's worth looking at. decide, okay, what's good for us in this situation, and move that other spouse on to Medicare or stay on. We can help you evaluate that. You're going to get a raise on the check, and you're going to pay a little out here, but you come out ahead. And if you have to use the plan, it should be less out of pocket for you, or potentially.
Sure, hundreds of dollars a month.
Yeah, yeah. You think about what that would save you.
Yeah.
Especially if what'd you say, $600? So you'd save $400 a month if you did, say, just Medicare and Advantage plan.
Almost $5,000 a year.
Yeah.
That's a big deal.
Yeah. Numbers talk.
On a reduced income. I mean, presumably, when you're on Medicare, you're winding down. You're not going to be working as much. Your income isn't going to be as high. Maybe you're on just Social Security. I mean, saving that money. Every penny counts.
For sure.
Once you're retired.
Yeah.
Yeah, because we see lots of examples where when people go to retire and they're taking money out of their account, we talk about the 4% safe withdrawal rate and all this, and those early years, people want to take more than 4%, right? They want to do a little bit of traveling, live up a little bit, and you're like, okay, is there spots where we can maybe cut that a little bit, try and bring it, get it to 6% instead of having it at 8%, because those numbers extrapolated out can have a huge impact.
Yeah.
So that's a great way, we try to talk to people about annually reviewing their budget and what their expenses are and stuff like that. That's a great place, to put that on the mark of saying, if there is an option you could get off of a group plan, enroll at Medicare, and reduce by $400 a month. That's a great opportunity.
And there are very few people that are working still that have good employer insurance.
Yeah, $500,000 deductibles. I mean, we run across them once in a while, but they're pretty.
Unions are usually pretty safe to stay, but I mean, very, very few people are have affordable group insurance.
Yeah,
especially for you and your spouse. So.
Especially at, I'll say, smaller companies, the deductibles you get, you're just like, whoa.
And that's the other thing too. We won't get into that, but if you're a 20 and under employer, you have different rules about how that works with Medicare than if you're a large employer. So you almost have to take Medicare when you're, I believe it is, when you're under the 20. So we have to look at some of those things. How big's your employer? So there's a lot of little things.
For sure
that come up. And one other thing, and maybe we would talk about marketplace a little bit.
100%. I want to talk about marketplace.
But one of the things about the years of experience is, does it make me smart? I have a lot of borrowed perception. And what I mean by that is when I sit here and talk to you, I'm going to learn something. I don't know what it is. We may be talking about something, and you tell me a medication you're taking. I go, I didn't know. And I start looking. I'll tell my other clients how they can get this or get whatever. So it makes me look really smart. But I've just learned it by sitting across from so many people. And when I learned that, make a note of it, mental note, and we can bring that back, because what I learned from you might help me with the next person. So we see enough people that you might think we're really smart. No, we've just talked to a lot of other people in your situation, and we've seen the situations, and we know how to then hopefully share that back, like, oh, you can save on this. And we have clients, just as one other example, they'll come in and we'll be looking at a medication, and it's really expensive. I said, listen, I'm no doctor, but if you go ask your doctor about these 3 medicines and see if they're equivalent to the one you're taking, this will save you X dollars a month because your insurance will cover this better than it will the one you're on. Now, obviously, your health is primary and you got to do what you got to do. But if the doctor says, this is as good as that, now we've got to. So that's another way we can save people money without endangering their health, and just show them there's other options out there. So again, borrowed things we learn from other people and things we learn from spending time on the computer looking up medications and stuff. You stumble across stuff sometimes. Make a mental note that could help somebody.
Yeah, for sure.
So
with medications or with certain employers around Central Indiana, we have people who come in from Cummins, and we know what kind of plan that they're offered as retired. We have people who come in from Knopf, and we know what they're offered from the state. And the more people that we have come in, the more access we have to
more
knowing
familiar
that those
we are
plans,
with what's out there. Yeah.
And being able to give you a good comparison and say, no, that plan's really good. You need to stay with that as long as you can. Or it seems good, but it's $500 more expensive than what it needs to be.
Yeah.
So
some of them have these different tiers of hospitals now. There's a tier 1 and a tier 2, and maybe majors in a tier 2. It's more expensive. So little stuff like that. Again, you could have a whole session on those.
Yeah, and that's stuff that the general public is probably never going to get to know.
They're
Right.
not.
They're not going to talk to enough people to get that information, and that's why meeting with someone such as yourself that deals with this every day, I think is such a big deal.
Yeah.
And people, like you said, they come in with so much anxiety, and you're like, you don't need to have anxiety coming in here. You just
Right.
This is what we talk to people about every day.
Literally every day. We're doing this or all year round, where a lot of agents, they're seasonal during, the
For sure.
annual enrollment period.
And they're one-trick ponies, and they're not full service.
Yeah.
They're salespeople. They're not service people. We're going to do look, the Medicare stuff we do, the Social Security, where we're signing people up. That's not. A lot of places don't do that. They don't. It's extra work. They don't have the extra time, the extra personnel, the desire to do it. It's just part of what we do. Now, we might get flooded with phone calls.
Yeah.
We have to manage
Well,
that.
it's not like millions of people watch this podcast.
Well, the hundreds of thousands. Well, I don't know. You start talking about people's money on their Medicare, they start going, send, share.
Yeah.
For sure.
So,
right. And that's one of the ideas that we originally had for doing this podcast was this is a way to get more information out there to people, because you meet with people and we like to say it's what's called the barracks attorney, right? Who's the guy who's telling everybody what the laws are, and it's watered down, not correct, and you get somebody in here and they start talking, and you're like, okay, well, let's talk about what's factual, not
absolutely.
And you
We
start
get a lot
getting
of
through that. Yeah. People think, oh, well, this is the rule. And you're, no, that's not the rule at all. This is what it is. So
Yeah.
I think it's super important for people to meet with experts in those fields. I really do. And, people are going to say, well, you say that because you're one of those people. I'm like, but it makes a huge difference.
It does.
Especially if you meet prior and learn something, and then you don't need to do it 10 years in advance, but as far as for Medicare, but you could do it a year in advance, be like, hey, what do I need to know? What do I need to be looking for?
I had people in yesterday who were planning on retiring later. They decided, hey, I'm going to retire at 62. They came in yesterday. We talked through some things and said, well, it's still a little too early. We can't do your Social Security. I was going to help them set up their Social Security. And we said, yeah, you're 3 months too early. Come back in later on. Or you can do it on your own. We can help you with it, whatever. And she won't even need health insurance right now, I don't think. So we're just doing that service for her. Now, when she's at 65, she will, but she's just going to be 62 and wants to get on her Social Security and stay home, take care of her new grandbaby that's coming. So that's the kind of planning that we're doing, helping people be babysitters for their grandparents.
Yeah.
So let me touch on marketplace just a bit, because a lot of times people are coming to you to want to retire early.
Yep.
When I say early, 67 is your full retirement for most people now, but still people look at 65. Or they have this, like your case, you're older, so if you were retiring and you were the one carrying the insurance, you'd have to make a choice for the spouse. Maybe she can go on her group insurance, but maybe she's working self-employed or for a small employer who doesn't offer it, then they have the marketplace. So we do that as well. We'll bring people in and show them how to. They don't have to go on Medicare or healthcare.gov. We can help them, find the right plans for that. There still are subsidies based on your income, but they are less right now because Congress failed to extend the COVID era subsidies that were there. So the subsidies are still there. They didn't go away. They just moved back to where they were before. And it's been shocking to people. So it's the Affordable Care Act. Affordable is in the eye of the beholder.
Yeah.
So, and it varies, but we can help people with that as well. And we have a lot of that with people who, I'm going on Medicare, I need to get something for my wife, she doesn't work, or she works at a place part-time, or whatever the case may be, or he works there. And so we sometimes have to work both of those, and then we transition them into Medicare when the time comes from them to get to that. So, but that can be tricky as well, because there's not a lot of companies to choose from. Some people see a name, and I'll throw it out there, Anthem, they say, well, that's the most recognizable name I see on your list. But the network's terrible around here on the marketplace. It's not like he had Anthem through your group employer, which has a great network. Mm-hmm. I don't think major hospitals on their network, so we rule them out. So again, you don't need, if you're trying to figure it out on your own, you wouldn't necessarily know that. So we know which companies have the best network and seem to be easy to work with, and can get you through that pretty quickly as well.
When we're meeting with people that want to try and retire early, healthcare is usually one of the biggest hurdles. Yeah.
Can I afford to retire and have insurance? That is key. You guys send people in here, or they come in here on their own to us because they're trying to figure out that major piece of the puzzle. You can tell them what they're probably going to be able to draw. They know what their Social Security would be if they take it early. The other piece is, how am I going to pay? I'm getting older. I'm going to have health issues. Mm-hmm. And so we are usually that final piece to help them figure that out.
And similarly to Medicare, probably even more so with the marketplace, but those plans they're not standardized like per household.
Right.
You and your neighbor could, so he and I are on the exact same marketplace plan. His premium is way different than what my premium
Right.
is. His max out of pocket is way different than what mine is, due to age, due to income, things like that. And people don't understand that. They're like, well, this is the plan that my sister
Yep,
has, and
yep.
she pays $50 a month. And I'm like, well, your sister's income, it's just her in the house. You have 5 people, and your income is 3 times higher.
You want a
than
lower
that.
premium, you need to talk to you about taking out less money.
Yeah.
And by the way, because we're probably getting close to a wrap on, I would want people, all the stuff we don't charge. We're paid
Yeah.
by the insurance company when we do stuff. We don't get paid for anything, as we said before, to do the Social Security stuff. We just do that because we know it's a service, and if we do that, you're probably going to come in when it comes time to do the other things. But we don't charge for that. And the product is the exact same price you bought it from me if you bought it off the internet, or you called the 1-800.
Well, that's not true about Marketplace, actually. You might not, if you try to do it on your own, the Marketplace, you might not get all the subsidies that you're eligible
Well,
for.
yeah, you might do it wrong, but I meant the
Yeah.
products are all the same.
Yeah, yeah.
And there's no, we don't charge more because you come to our office as
Right.
opposed to going directly to it's the same price anywhere you go. You're just not getting local expert advice to help you get there. So why do all that work on your own? I mean, you do
For
some if
sure.
you want, but why?
Yeah.
Come in, tell us your needs, and we'll help find a plan for you.
Yeah. I think that's a great resource for people trying to learn about it, is to talk to an expert, right? It's not going to cost you anything to just
Right.
come in, have a conversation, and be
Right.
like, what do I need to know prior to signing up? Previously, before I got into this industry, I worked in manufacturing for almost 20 years. And, when I got into this industry, I said, that's a very underserved a market, right? And you start talking to those people, and they're so intimidated by it, and you're just like, it's just basically because they don't know what they don't know.
Exactly.
You start talking to them about it, and then they're like, "Oh, I don't know anything." And you're like, "No, why would you know? You don't deal with this every day."
Exactly.
No.
I say that probably 3 times a week.
Yeah, no one expects you to be an expert in
I bring my
Medicare.
car to you because I don't know how this works.
100%, right?
So you let me do my job, you do your job, and everything's good.
And the value of us being doing this year round and having, thankfully, a stable office for people to come in and visit us. They can see the legitimateness of us,
Yep.
and they're sitting face to face. Versus, one of the biggest things that seniors face is the phone calls,
gosh,
and they're being
they're
scammed
terrible.
left and right, or they're talking
crazy.
to a call center. Just this year so far, the amount of people we've had to fix their plans because they talked to somebody over the phone who changed their plans. The people that you're talking to on the phone, they don't know
They're
Central
salespeople.
Indiana. They're in Florida
And they're-
calling you,
yeah,
and
they're not local. They're not going to service you. You can't pick up the phone, get an answer from them because they'll say, "Oh, you call the 1-800 insurance company."
yeah,
Yeah,
and
that's
they're
not a-
selling you on benefits that you might not be entitled to. On the commercials you see, you can get $3,000 of groceries and $3,500 of dental, and it's like, well, maybe
Yeah.
you can, and then they change you, and then it's like, oh, you don't actually qualify for that plan.
No.
Now we have to change you back
Bait-
if we can.
Bait and switch.
Yeah.
It's bad.
Yeah,
Yeah.
the whole scamming seniors thing drives me insane. I'm just like, I can't believe that this is what we have to worry about. And, we will have clients that call in and we're like, yeah, we don't think this is legitimate. You
Yeah.
should not do this. And they'll be
Never.
like, well, I think I'm going to see what's going on. You're like,
If anybody calls you to talk about your Medicare insurance, hang up immediately. Even though they might be legitimate, you don't know it's too complex to not see and hear. And then the aftermath of when it's done, where do you go?
Yeah.
You'll not find that person again when you try to call.
Yeah.
And
You won't.
Medicare and Social Security will never call you unprompted.
Yeah.
So just keep that in mind. If someone says they're calling from Medicare, that's a lie, and technically you can report them. Same thing for Social Security.
Yeah.
But they will never call you unprompted.
yeah, that's the thing. We say the same thing. They're not going to call you like unprompted, as you're saying there. And people are like, well, no, they had all my information. It's like, that should have been a red flag for you.
Yeah. That everything but your Social Security number?
Yeah, and they want you to give do not do that.
Yeah.
Yeah.
It's easy to fall for those, though.
Let's talk about where's a good place other than yourselves to get reliable information. Like if people want to do a little bit of research prior to coming in and talking to you guys.
CompassInsuranceGroup.com.
For sure.
I would only say Medicare.gov.
Yeah.
And it's still a little
that's gonna
too
be
broad.
general.
Yeah.
There are a few sites out there that do kind of serve. It probably needs to be a .org site for one. I don't really, honestly,
I don't know if any exist.
I mean, the ship counselors are out there for people as well. They will not enroll you. They'll give you general guidance.
What's a SHIP? SHIP?
Yes, those are volunteers. Every county has one. Those are people that work, usually they're the senior center.
Okay.
The senior center. And you can go in there. They will help you navigate. They'll ask you some of the same stuff we do. They don't probably know it is. They know it. They're very well trained. I'm not trying to play them down at all, but there are some aspects that they just don't know as well. But
They're
they're a
also
good
not
resource.
licensed.
They're not licensed people. They are 100% volunteer. Won't cost anything, but they'll help you find a plan. We have people come in and said, "Oh, the ship counselor talked to me, and this is it." And they come in, and I go, "Yeah, that's right." And we'll go ahead and enroll them because they can't enroll them. That's where it stops. They can provide guidance. Okay, but ship counselors, that's a federally provided program. In other words, besides that, the only place I can tell you safely without knowing off the top of my head is really, like you said, Medicare.gov. But then that's really
It's still very
that's still
broad and
yeah,
can
it's
still
very
be
broad
confusing.
and, yeah,
But you'll find a lot of answers there. It might not be specific to.
an independent agent, even if you're not close. I mean, we can work with you over the phone if some of your clients are wherever, the people that see this, but if you could find a good independent agent in your area that specializes in Medicare year round, that's good. But locally, we're right here in town, the corner of Bogstown and North Harrison.
Even centrally, we're not far from a lot of places.
Yep.
Right.
And people come from Geist. Do you have some people who come from
I got people.
Brookville and
I got people
Richmond
come
and
from all over.
yeah.
Anything you want to make sure we touch on before we wrap this up? I mean, we've touched on a lot.
We did.
Yep.
We're certified yappers, so
Yeah. We may put some people to sleep. I don't know.
It's something about putting these headphones on and sitting in front of a microphone.
yeah.
Yeah. I said, just don't talk to anybody on the phone that you don't know. I mean, you can talk to us on the phone, you know who we are now. But I mean,
Right.
just an unsolicited phone call from somebody, don't take those. You're going to get into something that may or may not be. It may be good. Don't get me wrong. They're not all scammers, but still not the same as sitting down with somebody that knows you, your neighborhood, and your stuff.
Same thing about calling the phone numbers on the commercials
Yeah,
or the
you're
mail
still-
that you get nonstop. You're never more popular than the months leading up to your
Yeah.
65th birthday.
Yeah, just
But-
sit down with somebody that knows.
Yeah.
Like I said, if it's not somebody that specializes in this, and you can sit with them and trust them and know that, hey, we're going to run into you in Walmart and Kroger and stuff. So
Yeah.
we're not going to.
Right.
I don't want to hear you complaining at the top of your lungs with everybody that I did something screwy to you. So
I was
I'm
in
not
a room
going to.
with three different clients last night, and I was just like, well,
Yeah.
there you are.
Yeah.
Yeah, for sure. Right. That's one of the aspects I love about working with people here. You know them, you see them, so that makes you care about them and want to make sure you're doing the right thing for them. There's all of these aspects of that I think people don't really think about. People are more like, well, I don't want my friends knowing my business. And it's like, you would rather somebody who doesn't care about you know about
Yeah.
that?
Right.
Yeah.
That's just the way I feel about
Yeah.
it. But
I
I
mean,
100% agree
Yeah.
with you guys.
And I don't mean it to say, right, but we're good at what we do because we've been doing it. And again, that borrowed perception, I talked to enough people, I've learned a lot from my clients. So it's we just want to share. We turn around and share that with them.
Yeah.
What's Medigap?
That's a Medicare supplement. So that's the government is the only one that uses that term, Medigap. The rest of the world calls it a Medicare supplement. It's the exact same thing.
Okay.
I don't know why they have to be different.
But it's very, Medicare supplement is used very broadly. I've noticed
Well, some
a
people
lot
call
of
it-
clients. Anything that goes with Medicare is a Medicare supplement.
They
to them,
call it
yeah.
that, but it's not. Medicare supplement, Medicare Gap, they're specifically
That
plans
product.
are not a Medicare Advantage plan. They work with Part A and B specifically. So we didn't really talk about that too much. We talked about it in general, but
Yeah.
But yeah, that's what a Medigap or Medicare supplement are really the same thing, interchangeable.
Awesome. Any last minute things, Ashley?
Yeah,
Thank you very much.
I mean, this is a topic I don't know a ton about. And like I said earlier, there were things I learned. I was like, whoa, what was that?
It could require follow-ups, honestly. I mean, we
Yeah.
could, there's a lot to it. So.
Yeah.
The contact information for Gary and Ashley will be at the end of this video. Do not hesitate to reach out to them if you have questions from the video that you're like, hey, I'd look for a little more detail on that. Do not hesitate to reach out to them. Reach out to me if you need their contact information. It'll be at the end of the video, but if you feel more comfortable reaching out, please do that. Again, go to our YouTube page, subscribe. Thank you for spending some time with us.